Hello everyone, my name is Dr. John Adam. Is your pet scratching, chewing at their paws, or shaking their head? Today, in this video, I'd like to go over the 3 reasons why you might have an itchy pet. The first reason being parasites. Now, of course, with parasites, we all think of fleas, but we also gotta make sure we remember there's ticks, there's mites, there's also lice as well. With parasites, usually it's an easy fix. So what we do is we put them on a good broad spectrum parasiticide that you usually get from your veterinarian, not from a local retail. The second reason, food allergies. Now with food allergies, a lot of my clients will mention, oh, I have my dog on a grain-free diet, or I don't have any chicken products in my food. But honestly, with food allergies, it's not what you're feeding, it's what you're not feeding. You just don't want to feed your dog or cat the allergens that they're allergic to, and every pet is different. With food allergies, the way we usually diagnose it and treat it is we put them through a food trial. Now with the food trial, we either put them on a novel protein diet, and that means something they haven't been exposed to, because you're only allergic to something you've been exposed to, or we put them on a hydrolyzed protein diet. What that means is that the processing of making that food breaks down everything so finely in the food that doesn't matter what the protein is in it, the body does not recognize it. With that, we usually have them on that diet for 8 weeks, and only that diet for 8 weeks. Nothing else passes those lips other than that diet. And if they're doing well, then we have 3 options. We either can continue with the diet because they're doing well with the diet. We can introduce individual ingredients and see if they react. And if they do react, then for future diets, we will eliminate that ingredient. Or we can take whole foods and try to introduce those diets. And if they react to the diet, don't use it. If they don't react to the diet, then we can use it in the future. The third reason is environmental allergies, or what we call atopy. And with this, the way we usually diagnose it is via an allergen test. Now, the over-the-counter tests, such as like the hair follicle test or the saliva test, they don't work. You need to have a proper allergen test. It's either a blood test or a skin test done by a dermatologist. And with these, we can detect what environmental allergies we have. Try to avoid them, but most of the time we're not going to be avoiding them. We're going to try to have a few goals. Those goals are to limit the amount of secondary infections we get from the allergens, and to control the signs, so of course itching, and to improve the integrity of the skin barrier. With that, there are multiple things we can do. One of the first things I usually recommend is putting your pet on omega-3 fatty acids. Omega-3 fatty acids are great natural anti-inflammatories and are great in keeping the skin barrier okay. I also love topical therapy. With topical therapy, it's doing medicated baths with a proper medicated shampoo from your veterinarian. And then if there's ear issues, doing ear washes a couple times a week to keep the ears nice and clean and dry, and to fight any overgrowth of bacteria, yeast in the ears. Also, with environmental allergies, we can do what they call immunotherapy, where we take the allergens that they're allergic to and put it either in an injection, or sometimes a drop you put underneath the tongue. And with that, we try to slowly introduce the allergens to the immune system so the immune system doesn't react to it as severely as it once did, and then hopefully dampen that allergic response. Now with environmental allergies, we have to remember this is not a cure. We're not curing environmental allergies. We have to manage these allergies. And so this is a lifelong treatment. So those are the top 3 reasons why your dog or cat might be itchy. I hope this video was helpful. I'm hoping to produce more videos about your pet so that you can be properly educated, so that when you do go to the veterinarian, you are able to understand what they are talking about. If you like this video, please give us a thumbs up and follow us. If you have any comments or questions or any future topics you want me to go over, please leave a comment below, and we'll talk to you later. Bye. Is that okay?
That was okay.
Okay. Anything should I change or?